Good morning, guys. Tony Maritato here, licensed physical therapist. And I don't do a lot of reaction videos, but I want to do one talking about talking with docs. I think this is an amazing channel. I think these guys do an amazing job. And they have a video that I want to touch on talking about the 5 mistakes people make associated with a total knee replacement surgery. So I've marked the video. I'm not sure how much of their content I'm allowed to share, so I'm just going to share a little snippet and I'm going to give you my 2 cents. I agree with everything they have to say until we get to the last one. And the last one's talking about return to work. We're going to talk about that and I'm going to share a differing opinion on that. But let's take a look at some of their content. So the first point, I'm going to let it play for just a little bit and then I'll discuss it.
Talking about patient mistakes.
Right.
Okay, so what's your number one, Paul? Number one mistake people make when they're getting a total knee replacement?
I think the number one mistake is not having a plan for post-op. All right,
Okay.
So you come in, you have your knee replacement, and then discharge planner comes to talk to you, and you're like, well, I got no plan.
Totally agree. Like having a plan for post-surgical care, knowing who's going to be with you, how are you going to get home from the surgical center? Are you going to a transitional care unit, going home the same day? It takes a lot of work. And then, of course, planning meals and laundry and paying the bills and doing all this stuff. You know, you want to hope for the best, plan for the worst. So hope for the best is you're going to have an amazing recovery, amazing outcome. You're going to feel great after surgery. Plan for the worst is what happens if something happens during surgery. We've heard stories of individuals who have had bone fractures during the procedure and end up being completely non-weight bearing or have to have some other procedure going on. What if you have to go to a skilled nursing or a transitional care unit after surgery? So plan for the worst, hope for the best, but have a plan in place. Have a supportive environment. Surround yourself with people that care about you, that love you, that aren't going to make you feel guilty for taking the next 2 to 4 to 6 weeks to really focus on yourself. Another video I'm going to record is talking about this being the best opportunity you have to really make changes in your life, long-term changes. They're right though. Plan to have somebody with you to support you through the time of need. Let's go to number 2.
Number 2 for me, and I see this all the time and it makes me crazy, is not taking enough pain medication.
Right.
Yeah. All right. Talking about pain meds, there is a lot of fear. There's a lot of anxiety, and rightfully so, about addiction to pain medication. Now, there's really kind of 2 things going on here. So some people just react negatively to pain medication. Some people get nauseous. Some people get, they just feel horrible with pain medication. I understand it. It's important that we realize that there are different kinds of pain medication and nobody knows what is best for you other than you. So if you're trying the typical pain medication route and it's not working for you, talk to your surgical team. Maybe they could prescribe something different, try something different. You need to find a way to manage the post-surgical pain. And I can tell you that a combination of the fear and anxiety around post-surgical pain, in addition to the actual post-surgical pain, probably puts the biggest barrier in your way to recovery and to gaining the range of motion. So have a pain management kind of program in place, then adjust it as needed, because almost never is it going to be perfect right out of the box. You're going to need to change positions. You're going to need to change medication, maybe timing of medication. Talk to your therapy team about it. Talk to your surgical team about it. But definitely get on board with an effective pain management plan. And that really has to be controlled by your surgeon. So let's see what number 3 is.
Okay, that's 2. What's number 3?
Number 3 is doing too much too soon after.
All right, totally agree. I've got a dedicated video I published probably a year ago talking about, am I doing too much? It's one of those situations where I am fortunate enough to still be in the clinic, still treat patients on a daily basis. And what I typically see, I rarely see somebody who does too little. I more often see somebody who's trying to do too much. And they're not taking into account the fact that, not to be graphic, they just had their leg cut off. They had their bones cut off, they had implants put in place, and then they had everything sewn back together. This is a major surgery. There's lots of involved systems going on here. You have to give your body time to recover. So in their mind, they're thinking about how they felt before surgery or even a decade ago. They want to get after it. They've been dealing with pain and suffering for so many years before surgery. Now they feel like they have a ticket to really push. Plus, they're scared. They're nervous. People who have had this procedure are so worried about not gaining their range of motion back that often they push too hard too soon. And it just ends up in a situation where they're really not able to keep up with the programming. So having ways to identify what's too much, and there are going to be days where you could do more and there's going to be days when you can do less. Often on the initial evaluation, if I'm seeing a patient in the clinic as soon as the day after surgery or a week after surgery, most of what we're doing is just making sure everything looks good, the incision is closed, there's no sign of infection, there's no sign of redness or excessive redness and swelling. And, even if I just get them up walking 25, 30 feet, they're exhausted, they're winded. It's because they've lost blood. They might be anemic after the surgery. There's lots of factors going on. So just understand that doing too much is just as harmful as doing too little. Let's see what the next point is.
You gotta walk before you run. Okay, so that's 3. Number 4 is kind of opposite of that, and for me, it's not doing prehab or not doing enough before. So doing too.
Not doing enough before. And you can, every insurance policy out there will cover at least one, if not more, prehab sessions, pre-surgical sessions with a physical therapist. I'm a huge advocate, obviously, because I'm a therapist. But I think that you should get in there. You should meet your therapist before you have your procedure. You should choose your therapist because different therapists have different personalities. A patient who works well with me might not work well with somebody else of a different personality. I'm not a drill sergeant. I'm not a big pusher. If, I'm going to try and cater the treatment session to your personality, but then somebody else might want somebody who's more aggressive, who's more of a pusher. You have to pick your therapist. You can't do that after surgery. After you've had your knee opened up and surgery done, you're pretty much going to get who you get if you didn't take this step to figure out who it's going to be beforehand. So I like to start 90 days. Like in my ideal dream scenario, if it was my mom, the mom of a physical therapist who's having a total knee replacement, 90 days before surgery, we'd start the programming. Now, I know you're thinking, well, my knee hurts. How am I supposed to exercise? I can barely walk. There's things that you would be doing for the hip, for the ankle, for the rest of the body. The knee only accounts for a small portion. If I can do upper body exercises to improve my cardiovascular system, to improve my recovery, to gain strength in my arms, which are going to be used on the walker, absolutely I want to do that. If you tell me that you have a rotator cuff issue and you can't do upper body things, I'll find other things for you to do. I promise you that if you're living independently, there are exercises that you can do that won't make you feel worse. Likely will make you feel better, but it can only be done after a comprehensive initial evaluation with a licensed physical therapist or occupational therapist. So not doing enough prehab therapy before the surgery really makes it that much more challenging to recover after surgery. Let's see what their last point is, because this is the one that I want to talk about a little bit. Let me get into that video.
I think that's a great one. So that's number 4. Number 5 for me, and this is a little tricky because everybody's lives are a little bit different, is going back to work too soon.
Going back to work too soon. I can tell you from personal experience, I always try to look inward first to see how I respond. Those 2 words are actually really interesting words, react versus respond. Reacting tends to be a negative outcome, tends to be something not really positive. Responding tends to be a positive outcome. Take a medication, the patient reacted. right? They had an allergic reaction. Whereas I take a medication and the patient responded. So when I'm thinking about post-surgical recovery, total knee replacement, I find that patients who have a purpose, who are driven, who have a goal bigger than themselves, whether it be their job. Now, obviously, if you hate your job, if you don't have satisfaction in your job, if it's not something that makes you fulfilled inside, there's no benefit to going back sooner than you need to. Take the full time to recover, take 12 weeks, take 16 weeks, take whatever you need. But if you have a purpose, whether it be your job, whether it be your church, whether it be some other community, taking care of pets, whatever it is, if you have something that you can get back to that is motivating you, pulling you, drawing you back, I find that it provides you with a lot of benefits. It helps distract you from some of the pain and soreness you would otherwise be kind of perseverating on if you didn't have a purpose. It helps bring you joy and fulfillment. It gives you something to work toward. So while, yes, if you are just in a dead-end job that gives you no satisfaction and you don't enjoy, don't go back to it that quickly. Take this time to really help yourself, focus on yourself, improve yourself. But if you have a bigger purpose, if you have something that does bring you joy and fulfillment, don't necessarily stay away from it. Go back to it. Find those things that you can do. And check out Tucker, that you can enjoy so that, you did this for a reason. You did this to fulfill a bigger goal, and that goal will help you in the recovery process. So first, thank you guys. If you've watched this far, I greatly appreciate it. Thank you to the docs here for sharing their knowledge, their content. There are so many amazing surgeons out there who just don't have the time to share this information with the public. I will post a link to their channel down in the video description below. And if you have any further questions, please feel free to reach out. I'll catch you on the next video.